All right, welcome back, everyone. Today we're going to be doing a deep dive into something super important, especially if you're a dental professional.
Yeah, mental health in UK dentistry. Big topic.
It is. And get this, we're looking at a research article. It just came out this year,
Oh, hot off the presses.
right? From the International Journal of Dental Hygiene. It's called Burnout, Stress, and Wellbeing, the Rising Mental Health Crisis in UK Dentistry in Dental Care Professionals, a Quantitative Perspective. Catchy, right?
Well, the title's a mouthful, but yeah, it's a really important study by Durkin and Mumford. Gets right to the heart of what a lot of dental professionals are feeling these days.
So for this deep dive, we're really focusing on what this research tells us and what it means for dentists, like practically at the chair.
Exactly.
So they wanted to figure out if working for the NHS, versus private or mixed practices, if that was adding extra pressure, especially for hygienists, therapists, and nurses. Like, is it tougher on their mental health?
Right. And to get a good picture of that, they talked to over 200 dental professionals all across the UK.
Gotcha. So like a good mix of folks.
Yeah, mostly women, which reflects the demographics of the field and from all different types of practices.
Okay, so good representation then. So what'd they find? Was the NHS the big bad wolf, stressing everyone out?
Well, it's interesting, actually. They measured stress using this thing called the perceived stress scale. It gives you a score out of 40.
Okay, so higher score means more stressed out, obviously.
Yeah, exactly. And anything over 13 is considered like a moderate to high stress level. But what they found is that stress levels were high, like really high for basically everyone, no matter what kind of practice they worked in.
Really? So even private practice dentists were feeling the heat?
Oh, yeah. Big time. Like dental therapists and hygienists, whether they were NHS or private, they were scoring in the mid-20s on that stress scale, way higher than the average person.
Wow, mid-20s. That's not messing around. What about burnout? Did they measure that too?
They did. They used the Copenhagen Burnout Inventory, which basically looks at how emotionally exhausted you are, how cynical you feel about your work, that kind of thing.
Right. Because burnout's more than just being tired. It's like you're fried.
Totally. And the results, well, not great. Most of the people in the study across all the different practice types said they were experiencing at least moderate burnout.
Oh man, that's rough. So it's not just they're stressed, it's like it's affecting how they feel about being a dentist.
Right, and it's not just therapists and hygienists either. They also looked at well-being scores using this WHO-5 well-being index. And guess what? Dental nurses actually scored lower than the hygienists and therapists.
That is interesting. Any idea why that might be?
It's hard to say for sure, but it could be that dental nurses have less, autonomy in their roles, less control over their day-to-day work.
Yeah, that makes sense.
Maybe they're dealing with more difficult patient interactions too, or feeling the pressure if their practice is short-staffed, and that constant stress can really wear you down.
For sure. But okay, back to the NHS thing. You said they didn't find a big difference in stress levels. That's kind of surprising, right? You'd think NHS dentists would be way more stressed.
You would, wouldn't you? But this study suggests that it's more complicated than that. Maybe it's the workload in general, maybe it's demanding patients, maybe it's even bad management. It seems like those things are bigger factors than just whether you're NHS or private.
Hmm. So it's not just where you work, but how the whole place runs that's making the difference.
Yeah, I think that's a really key takeaway from this.
And, it's something for any dentist to think about. Like, what's the vibe in my practice? Is it supportive? Am I taking care of myself?
Exactly. It's not just about the system. It's about creating a good environment wherever you work.
Okay, so we've got all these stressed out dentists. What can they actually do about it? Like, what does this mean for how they practice dentistry every day?
That's the million-dollar question, isn't it? And that's what we're going to get into next. So, yeah, we're talking about a pretty serious problem here. It's not just about telling dentists to take a yoga class and call it a day.
Right, it's got to be more than that. So let's say you're a dentist listening to this and you're thinking, yep, that's me, mid-20s stress score all the way. What can you do? Like right now, today, to feel better?
Well, okay, first of all, you got to know yourself, right? Like, what are your own personal red flags when you're starting to get stressed or burned out?
Yeah, like how do you know it's happening?
Exactly. Do you find yourself snapping at people more easily? Are you isolating yourself, not wanting to hang out with colleagues, or even your family? Are you just bone tired all the time, even after you've slept?
It's like noticing those early warning signs.
Totally. And once you know what to look for, then you can start doing something about. And that something is different for everyone. It might be exercise, maybe it's getting out in nature, listening to music, whatever helps you chill out and recharge.
So find what works for you, basically. But what about the bigger picture stuff? Like, what can dental practices do to create a healthier environment? Because it can't just be up to each individual dentist to fix this, right?
Absolutely not. This is where the people in charge, the practice owners and managers, need to step up. They need to get that Supporting their team's mental health, it's not just a nice thing to do, it's good for business.
So it's not just about being nice, it's about the bottom line, too.
Exactly. Think about it. If your team is stressed and burned out, patient care suffers, productivity goes down, and you have people quitting left and right. Creating a good work environment, it's an investment, it pays off.
Okay, I'm sold. But what does that look like in real life? How do you actually do it?
Well, a big one is workload management. Dentists are often pushed to see as many patients as possible, and that can make you feel so rushed and overwhelmed.
Like you're on a hamster wheel.
Right. Practices need to think about realistic schedules and make sure they have enough staff to handle the load.
So quality over quantity, basically, giving dentists enough time to actually do their job well without feeling like they're just churning through patients.
Absolutely. And it's also about creating a culture where dentists feel like they can speak up if they're struggling, without being afraid of getting in trouble.
Yeah, but speaking up is hard if you think you're going to get punished for it. Practices need to make it clear that it's okay to ask for help.
Totally. You need open communication, regular check-ins with staff, maybe even anonymous feedback surveys. Some practices even have mental health professionals on call for consultations.
Oh, that's interesting. So it's about having systems in place to actually deal with these issues. But what about that whole suck it up buttercup mentality that you see in dentistry? How do we get rid of that?
That's the tough one, right? It's about changing the whole mindset, moving away from this idea that dentists are superheroes who never have a bad day. We got to make it normal to talk about mental health, the good days and the bad days.
Dentists are human, after all.
Exactly. They have emotions, they get stressed just like everyone else, and pretending otherwise just makes things worse.
Yeah, it's like trying to run a marathon on a sprained ankle. You might be able to push through for a while, but eventually you're going to crash.
Perfect analogy. And it's not just about the individual dentist either. It's about the whole team being supportive, celebrating each other's wins, helping each other out, that kind of camaraderie.
So everyone feeling valued and respected, not just as a dentist, but as a person.
Yeah, that's it. But that kind of culture change, it doesn't happen overnight. It takes time, open communication, and a willingness to challenge the old ways of doing things.
Sounds like a lot of work.
It is, but it's worth it, and the good news is there's a growing movement in dentistry to make this a priority. There are more resources available now than ever before, and more dentists are speaking out about their experiences.
Well, that's good to hear. What about those resources, though? What's actually out there for dentists who are struggling? Like, where do they go for help?
There are some great organizations out there specifically focused on helping dental professionals with their mental health. They offer confidential helplines, support groups, even financial assistance in some cases.
So you're not alone, basically. There are people who get it and want to help.
Exactly. And there are things you can do on your own, too, to stay mentally healthy.
Like that, besides the self-care stuff we talked about.
Well, boundaries are super important. Learning to say no to extra work, not taking work calls after hours, making sure you have time to actually disconnect and recharge.
So giving yourself permission to take care of yourself, even if it means saying no sometimes, which I gotta say can be hard for dentists.
Oh, it can be really hard. Dentists are often so dedicated to their patients, they forget about themselves. But remember, you can't pour from an empty cup. You got to take care of yourself to take care of others.
Okay, you've convinced me. But we've talked a lot about what dentists and practices can do. What about the bigger picture? Like, what can professional organizations and, I don't know, the government do to help?
That's a great question, and it gets us into those system-level changes we talked about. Professional organizations can really push for policies that support dentists' well-being. Things like making mental health services more accessible, promoting flexible work arrangements, and even changing how we train dentists so they're better equipped to deal with stress and prioritize self-care from the get-go.
So it's about creating a system that actually supports dentists, not just burns them out.
Right. And policymakers, they have a role too. They can fund mental health initiatives, support research into burnout, even implement regulations to promote healthier workplaces.
Sounds like we need everyone to work together on this.
We absolutely do. It's not a one-person job. It's about collaboration, open communication, and a willingness to shake things up.
Speaking of shaking things up, I keep thinking about that finding that there wasn't much difference in stress levels between NHS and private dentists. Does that mean we shouldn't worry about the NHS? Like, is it all good?
I wouldn't go that far. This was just one study, and we know the NHS is under a lot of pressure right now, and that pressure definitely affects dentists.
So maybe working in the NHS itself isn't the main cause of stress, but it's part of the problem.
Right, and we can't ignore that. We got to keep talking about it, keep advocating for changes that make the NHS a more sustainable and supportive place to work for all dentists.
Okay, that makes sense. It's like this conversation about mental health and dentistry, it's not over. There's still a lot to do. But for our listener right now, if you're a dentist and you're feeling overwhelmed, what's one thing you can do today to start taking better care of yourself?
That's a really good question, and there are so many answers. But if I had to pick one, it would be to reach out, talk to someone, a colleague, a friend, family member, or a therapist. Don't try to deal with this alone.
It's so true. Just talking about it can make a world of difference. So we've covered a lot of ground in this deep dive. I mean, we've looked at the research, we've talked about how this stress and burnout actually feels, and we've even brainstormed some solutions, both for individual dentists and for the whole system.
Yeah, it's been pretty comprehensive, and I think it shows that a dentist's well-being, it's not just about them as an individual, It's connected to their workplace, how the profession views mental health, even what's going on in society at large.
So many pieces to the puzzle. So if we had to boil it down, what are the big takeaways for our listeners? Like, what should they be thinking about, especially if they're dealing with this stuff themselves?
Well, first and foremost, stress and burnout are rampant in UK dentistry. And we're not talking about a little bit of stress here and there. This is serious stuff that can impact dentists' whole lives, not just their work.
And we can't just pretend it's not happening, right? Like, the research is clear. This is a big problem.
Exactly. And the second takeaway is that we can do something about it, both as individuals and as a profession. Dentists can learn to recognize when they're getting stressed, they can build those self-care habits, set boundaries, protect their well-being. That's only half the story.
Right. It's also about creating a culture of support in the dental practice, even in the whole dental community. Talking openly about mental health, making resources available, training people how to help, and pushing for policies that put dentists' well-being front and center.
Exactly. Which brings us to the third and maybe most important takeaway. You are not alone in this. There are people who care and want to help. So never afraid to reach out. Talk to a colleague, a friend, a family member, or a therapist. Asking for help, that's a sign of strength, not weakness.
It's a message we need to shout from the rooftops because that stigma around mental health is still so strong, especially in a profession where you're expected to be perfect, to just power through everything.
I know, right? We got to keep talking about this. Make it normal to have these conversations. Build a culture where it's okay to not be okay.
Love that. Okay, before we wrap things up, I want to leave our listener with something to think about. We've talked a lot about the problems, but what if we could reimagine dentistry? Like, what if it was a profession that truly cared for the people providing care, not just the patients?
That's such a great question. Imagine if dentistry was known not only for its technical skill, but also for how supportive and compassionate it was, where dentists could actually thrive, both as professionals and as people.
Where taking care of the caregiver was just as important as taking care of the patient.
Exactly. And I think we can get there, by working together, having these conversations, advocating for change, and supporting each other.
I love that vision. All right, that's a wrap on our deep dive into mental health and UK dentistry. We hope this has been helpful, informative, and maybe even given you some hope. Remember, you're not alone. There is help out there, and there's always reason to be hopeful.
Thanks for listening, everyone. CACI.